I think we've answered a lot of questions already today. So I want to talk to you a little bit about something that I'm kind of passionate about and some things that we're working on in collaboration with SAGES and American Hernia Society. And it's going to be a little less scientific, but I think something that's equally important to what we're trying to accomplish. These are my disclosures, but we're not going to be talking about anything specific related to them today. So what are my objectives for today? Well, I want to give you a little bit of background on labeling standards. What's out there? What do we do currently? Where have we fallen behind in comparison to other societies or other organizations? Where are we now? And then finally, kind of where should we go and where do we want to be? So I'm going to paint you a picture. Imagine that you're going to the grocery store and you want to get some Campbell's soup. And you go to the soup aisle and you see that the Progresso's on sale and you pick up 2 cans of soup and you can look at those head to head. You look at the nutrition label, you can see which soup has how much sodium, how much fat, how much cholesterol is in there, because that label is presented in a very easy to compare way, the same thing across everything that you look at in a very standardized fashion. Well, how did we get to that point? It wasn't an easy thing. It actually goes back to 1966, and what was passed is called the Fair Packaging and Labeling Act. That required all consumer products to honestly and informatively label what was in them. Before them, there was no regulations. People could put anything they want on their label, whether it was true or not. And this was supposed to apply to food, drugs, cosmetic, and even medical devices. But it wasn't for about another 25 years until we came out with what's called the Nutrition Labeling and Education Act. That finally standardized the way that those labels that we're so familiar with came about, and also came up with standardized terms. Low fat, light, all those things have very clear characteristics about what they can actually say. And as you can see in this picture on the right, it also stipulates how these labels are formatted very, very specifically. The font size, the indentation, everything is regulated. So again, as a consumer, when you go to look at what you're buying, you see everything in a very consistent manner. Well, how did those come about? Those are actually acts of Congress. It went through the House, it went through the Senate, eventually was signed by the President to become a federal law in order to get to that point. And unfortunately, to this day and age, we have no similar mandates for medical implants or what we're putting in our patients every day. There have been some efforts along the way to try and create some standards. This was a project put together by what was called the Global Harmonization Task Force. This was back in February of 2000. And they came up with some guidelines that implants should have the name and the manufacturer, seems pretty logical. Details for the user to identify, although they didn't really specify what exactly that meant. And lot number and expiration. I think in general, those things are currently available on the products that we use. There are other areas that people have put a lot of work into. Our orthopedic colleagues are probably leading the way. So for those of you who are familiar, ASTM, which actually had some of the testing standards that we heard about in the first talk, this is the American Society for Testing and Materials. They actually came out with an initiative a little over 5 years ago looking at ways to standardize the labeling for orthopedic implants. So all things would be presented in that similar manner to what we're used to with the nutrition label. Unfortunately, it still relies on manufacturers to embrace and implement this project along the way because there are no regulations from higher up. What's called the International Council for Commonality in Blood Bank and Automation. They cleverly shorted that down to the ICCBBA. They've done some collaborative work with the World Health Organization to take what's called the ISBT 128 standard. So there's a lot of these terms that are out there, but essentially they made an effort to standardize the terminology for coding and labeling of medical products, specifically of human origin. So we're talking about biologics, even cellular type things. But unfortunately, this is kind of what they came up with, which unless you have an advanced degree in mathematics is really kind of hard to understand what exactly that meant. They did try to standardize it a little bit more into this sample label that's out there. And you can see it has some very, very basic information, what the kind of product is, what's in there, the serial number, the expiration date, again, all things that we're familiar with seeing in the operating room, but doesn't really provide you a lot of that endpoint user information that we may need to make our decisions at the time of the operation. So we went a couple years ago and did a study, looked at a lot of our mesh throughout the hospital to see what is currently out there. What do our products say about the mesh that we're implanting on a day-to-day use? Clearly, or with the intention of saying, when you're in the operating room and making your decision about what kind of mesh you're going to implant in the patient, how readily accessible is that information that you may need to use to decide what the best product to put in your patient is? And so what do we find? Well, really not a lot. We looked at 36 different meshes that were available at our institution. And when you look at the actual label itself, so you take the product out, you pull it from your Omnicell, your nurse brings it in, what do you see? Well, just under 3/4 of the mesh actually talk about what the base material is, whether it's that polypropylene, polyester, PTFE, whether it's biologic, where that biologic source came from. Even less talk about some of those other characteristics that we learned about in the first talk, again, that we think are important in trying to decide what kind of mesh you're going to implant. 25% talked about what that filament type was. 53%, so just over half, actually talk about the absorption of the mesh. So some of these meshes that have coatings or even absorbable, they didn't even talk about how long the mesh was there or when it was resorbed. Specifically, even whether it was resorbable or not, or then what the resorption time was. And so clearly, we think this is a shortcoming for people when you're in the operating room trying to make your decision on what you're going to do. So what options are out there right now? This is a database that's run by the FDA. It's called GoodID, or the Global Universal Device Identification Database. And this is a good start. It actually contains key device information as far as what the specific products are, and they are actually trying to present this in a standard manner. And this actually has led to a standard number and barcode that's on most of the meshes that we use today. So if you go to their website, if you just Google search GoodID, and you can get to their website, it's open to everybody. And if you just quickly search for mesh, there are 19,642 unique products that come up. Every specific mesh, every specific type, sizes, all those sorts of things have a different number. It's not really the lot, so we don't know which specific device goes into which specific patient along the lot line, but there's one for each unique product. So it can be certainly overwhelming when you look at what's there. So this is a sample page that comes up when I just picked one of the commonly used meshes, and this gives you a little bit of information. They talk about the brand name, what the version and model number is, what the catalog company thinks, a lot of details that really don't help your decision making along the way. They do have some information on device characteristics. You see, as you go a little bit lower, you can expand some of those options. But the device characteristics are really pretty limited. There's nothing about the mesh itself, and you actually have to go and search for what these things say. It's not something that's readily available. Again, thinking about when you're in that shopping aisle at the grocery store. You can see here some of the things they talk about. MRI safety, that's good to know, but doesn't really impact how you decide what you want to use. Most of these are for single use. Most of these require a prescription to use and are not available over the counter. So nothing that's really that useful in our day-to-day life. So where do I think we need to go? So this is an initiative that, as I started off by saying, that we're working on in partnership with SAGES and AHS to kind of develop a standardized label. Again, thinking back to the way you buy food in the grocery store, can we present useful information in a consistent format so every time you want to make a choice in the operating room, you can hold those two meshes next to each other and say, oh, this one is lightweight, this one's heavyweight, this one's resorbable, this one's permanent, and make that informed decision when you need to take care of your patients. So what things are out there right now? So we can actually utilize that GoodID tracking number to improve our identification. So actually a lot of EMRs, depending on where you're at and what your institution does, they will scan that universal device identification number, and it does go into the record. So it's something that's there that can be backtracked along the way, but unfortunately it's not very easy a lot of time to find, and ultimately requires a good nursing staff in the operating room to take care of those things. And even at our institution, even though everything's just barcoded, a lot of times after the fact you'll find they just type in the number and you don't get to track the lots and all those sorts of things. But we do have options. They are getting better to try and use those universal device numbers so we can consistently track what we're putting into people. And I'm just going to kind of summarize a little bit here on what can you do, like what's available right now. Well, we're working on some of the backside to get our congressmen and women on board so we can get a similar law hopefully passed in the next several years. But I think that's an initiative that's really going to be important to expand not just to hernia mesh, but for all medical implants. That thing needs to be done. But what can you do now in your own institution? These are easy things to do. We see a lot of referral patients who've had recurrences of the hernias, and how often do you read the operative note to try and see what was done? And no places are mentioned what kind of mesh that was put in, what the brand name was, how big it was, or even where it was put in. So when you document your operative note, when you dictate your case, say the brand name, say the style of mesh that you use, say the size of the mesh. Yeah, it's your operative report. It's not a commercial bias. Just put that information in there, because if somebody has to go back, if they have a complication down the road, that's our first step for us to be able to track some of these things along the way and get a good idea of what you're putting in there. Ideally, you'll dictate your lot number. Those things should be tracked by your hospital. But again, as we see referral patients who may have had a complication in one form or another, it's hard to go back and pull some of those records from the hospital. So take a sticker if you need to, dictate your lot number, but at the very least, the brand and the model of what you implanted into your patients. So just to summarize here a little bit, I think we're behind the ball. I think there's a lot of areas for us to really improve what we want to do. As I've learned as we've been working on this kind of on the backside for the last couple years, it's not going to be easy. We need to, in order to really do it right, we're going to need to get some mandates from our government. The industry is actually interested in this. So in talking with industry partners, they do have interest, but understandably, they don't want to implement something without some guidance along the way. And we can all do our part. It's very simple. As you dictate your operative mode, take your time, and summarize what you did. So on that note, I'll thank you for listening to kind of what I think is a really important initiative that we're working on. And we'll, like I said, we'll take questions and discuss things towards the end.